Hey y'all, Cat White here, one of the trainers at Bird Boot Camp Fort Mitchell. I just wanted to kind of hop on here and give you like a little announcement that this video does involve needles. So if that's something that makes you queasy, maybe this video is not the one for you. Having said that, the video is kind of scooted back so that it's not as intense. You can't exactly see every needle going into the skin. So just wanted to let you know that. And to give you kind of a rundown of what was going on. I was having intense shoulder pain on the right side. I couldn't get rid of it no matter how hard I tried. And this is something that's been going on for years. And yes, it is still a work in progress, but this whole experience made it way better. So I really wanted to share it with you. Without further ado, Danny is coming up. He's the man. He's going to explain to you step by step his dry needling technique. Enjoy.
Obviously, your symptoms are the most important, but kind of what you're feeling is also extremely important.
Uh-huh.
So if you touch your chin to your chest, does that increase any symptoms? Okay. If you look up towards the ceiling, does that increase any symptoms? If you go, let's go your shoulder there. Any symptoms?
Like
there?
a little.
Okay.
Nothing too bad.
And where do you feel that? Is it in a familiar area?
Yeah, it's like right in here.
Okay. And then if you go to, any symptoms there? Okay. And then let's look over your left shoulder first. Any symptoms there?
No.
Okay. And then look over your right shoulder. Any symptoms there? Okay. Good. If you look at the literature for shoulders, if you're working with a shoulder and you don't address the cervical and the thoracic spine, you're not going to have full success. So working with the shoulder, we can just do the shoulder and we can get you back to doing what you're doing, but it's going to come back.
Right.
Does that make sense? So that's why we start with the neck. Always start with the neck and see if there's anything from there. The thing with the thoracic spine is it doesn't move a whole heck of a lot. It's not supposed to. So that's a little bit harder to tease out. And typically the way that we tease that out is by working with the shoulder, working with the neck, and if there are symptoms that just won't go away, then we go into the thoracic spine. That's kind of what we do. There are ways to do it, but I find in practice that you can learn pretty quickly, and then I'll just do a technique for the thoracic spine, and if it changes, it's good. There's also something called rib 2-3 syndrome, and that one, it presents exactly like shoulder impingement. Any test that would be positive for shoulder impingement is going to be positive if you have rib 2-3 syndrome. So sometimes you got to get into the ribs even to get rid of shoulder pain fully.
Okay.
So you're not necessarily, I mean, we can look at a couple things. Like if you take your right arm and go to your left shoulder, are there any, does that?
It feels tight, like doing that, yeah, it's like really tight.
And what if you lift your elbow? Any symptoms?
Yeah, I can feel it there.
Okay.
Yeah.
So that's a shoulder impingement test. So I'm gonna do one with, you can rest your arm there. I'm gonna do one now. My hands are cold.
You're fine, you're totally fine.
This is impingement as well. Any symptoms there at all?
No, it just feels tighter, a little tighter.
Okay.
Yeah, I get that, yeah.
Relax. So there's a couple things going on here. You know, we can get some symptoms with the neck, but with where you're having your symptoms, like along that upper trap, along that levator scap, we would expect that because they go shoulder to neck. But the shoulder impingement stuff is interesting because typically people with pure shoulder impingement, they're like, my symptoms are here or here.
Yeah.
So this is definitely multifactorial. So when we get into the needling, which is what we're about to get into here, we're probably going to stay to the back. Okay. Now, we just did 2 tests. What I like to have is I like to have 2 things where we can reproduce your symptoms. We kind of have 3 because this one did a little bit. So what we're going to do is we're going to get into the needling and then we're going to test these again. And we're going to see, is it worse, is it better, is it the same? Okay. The worst thing a physical therapist can hear is it's the same because that means we weren't even in the right area.
Right.
So with this quick little assessment that we did, I have an idea of where I want to go and some things that I would want to do. But you know, the dry needling is definitely something that we want to look at, and that's why we're kind of taking the time today to talk about. So we'll start there and then we'll test those things. Okay. Before we start, do you personally have any questions about dry needling?
Not off the top of my head.
Because we'll cover it.
Yeah, we'll pretty much cover everything.
Yeah, we'll cover it in the video, but it's a great place to start. So what we're gonna do with the area, do you feel like that's loose? Like, am I able to, if I were to like roll that back a little bit, would that bother you?
No, I mean,
Okay.
I can take off the shirt.
No, if I can get there, as long as I can kind of get there, it'll be okay.
Well, I mean, I don't know. I mean, with the type of sports bra I have on, that's the only thing I don't know. So, I mean, I don't know where you have to go. So really.
Sure. So it's up. We have a couple options. Obviously, no matter what, I'm gonna use towels to get where I need to get.
Okay.
It seems like the clothing is kind of loose, so I think with the towels, I'll be able to manipulate to get where I need to get.
Okay.
So if that's okay with you, then you're
Totally
perfectly fine how you are.
Okay. Yeah, that's fine.
So what we're gonna start with is I'm just gonna have you go ahead and get onto your belly for me, please.
My head there.
Yeah, and you can take your mask off for that because you're gonna be facing down, so it's already not an easy position to breathe in. I'm gonna slip this under your ankles.
Okay.
This is just kind of a comfort thing. If you don't like it, I'll take it away.
Okay.
Is that okay there?
Yeah. So.
Okay. So I'm gonna grab the needles that we need here. And then some towels.
It is so comfortable. It's so nice.
It probably feels nice to lay down for a second.
Yeah, it does.
I gotta grab another box.
Okay. Do you do a lot of dry needling?
I do. You know, it's kind of a popular thing right now.
Mm-hmm.
So people come in, you know, and that's what they want because they heard about it, or physicians are even starting to refer for it.
Mm-hmm.
And the thing with physical therapy is I don't need a referral to do this.
Right.
You know, we're becoming more and more autonomous as practitioners, which is awesome.
Yeah.
But you know, when we do get a referral, sometimes they have opened up their script pads to include dry needling. So some of them will have that on there. So we're gonna use a couple different size needles today. Do you have any aversion to needles?
No.
Okay, let's say, because if you do, I won't talk about them. But
Yeah, you're fine.
you know, I've needled people with aversion to needles, and because of how they feel after, they're okay with it.
That's awesome.
They just don't want to see it, and that's fine. I don't need to like wave a needle in front of your face or anything like that. Is it okay if we switch your hair to your left side?
Yeah.
That's perfect. Yeah. So I'm just gonna start placing some towels down so I can get where we need to get to. Does that feel like it's choking you?
No, not at all. I feel like I've always kind of had this tension in my right shoulder.
Really?
Just because I played basketball for so long,
Oh,
I feel
nice.
like just like that repetitive motion
Sure.
of shooting
Definitely.
is really just.
I mean, especially and I take it that you're a right-hand shooter.
Yeah.
So with that, you're using that a whole heck of a lot more than you're using. Sorry for my cold hands.
You're fine.
Than you're using anything else. I'm gonna check something right here. That tender there?
Yeah.
Okay, let me check your left side here.
And that would just
Tender
say,
there?
yeah.
Okay. What we get to though is we get to your first. So what I'm checking there is your first rib. It's kind of hard to do in this position, but basically to get to your first rib on this side, that's the pressure that I have to go with.
Yeah.
To get to your first rib on this side, that's the pressure.
Wow.
Can you feel the difference there?
Yeah.
So that's another thing that we might look at really quickly after needling. There's nothing I can do to that first rib needling wise with it being elevated, but there's a manual technique that's super quick that I can do if we don't get a change that we want. I gotta map out your shoulder blade. So the thing with working with a shoulder, a lot of the muscles that move our shoulder are on our shoulder blade. Not all of them, but a lot of them are. The rotator cuff muscles, they do come and sit over here as well. So to actually needle to the shoulder blade is very therapeutic. The issue with that is the lungs sit under
Oh, yeah.
the shoulder blade. So you have to be very cautious. If you don't want to miss the shoulder blade, essentially. So you need to know where it is. And so it's always good to be real cautious and just map it out. In the course that we took, they had us draw, but I don't do that anymore. I just map it out. But when I was nervous and just starting, I was like, if I hit somebody's lung, I'll kill them. Then I drew on them. But now I'm like, I know well enough what I'm doing, so.
Yeah, for sure.
I started to mention this, but there are all different lengths of needles, and a person's body is going to dictate what you need. So somebody who has a little bit more tissue, you're going to need longer needles to get to what you need to get to. Someone who's a little bit leaner, you don't need quite the length of the needle. But the issue that lies with needling is if you don't get to the area that you're targeting, you're not going to have the effect that you want. Japanese acupuncture, they tap the needle in and they leave it. So they go very superficial with it and they do get results. But I think that in the literature, if you look, the more prominent results come from going deeper. And that's kind of what we're finding with some of this dry needling literature as well. So we're gonna start. So each needle is individually wrapped. It has its own guide tube. So the first thing that you're gonna feel is just like a plastic tube. Okay there? We get to the level of the shoulder blade. So we go to the shoulder blade so we can get the tendons that attach onto it. We just went through some tissue, but there's tendons that attach too. So we get to it, and then we create just a little bit more trauma. You okay?
Mm-hmm.
And this little bit of extra trauma is what brings all the good healing factors down, which I'll talk more about that while we're sitting.
Yeah. I'm like so relaxed. This feels so good already.
That's awesome. This is a technique that I'm a huge fan of, and I know, like, Kat, you and I talked about that yesterday, but a little bit, but I really do appreciate this technique. Okay.
Yep.
So what I'm doing here is, it's called periosteal pecking. So I actually go, like I was talking about, I go to your shoulder blade, that's the bone, and then I just kind of bounce up and down on it, almost like a jackhammer on concrete, except the tool can't break what it's poking on. And that gets a little bit more, that causes a little bit more trauma, and that is what we're looking for. We also have a couple muscles that sit under the shoulder blade that we can't really get to with the needling, but they'll kind of poke themselves out the side where the tendon is, and we can get those tendons by kind of going around the edge of the shoulder blade. Sorry.
Oh, you're fine.
Some are more tender than others.
I think it's just like a reaction, automatic.
Definitely.
So crazy. It's like you're doing it back there, but I can like feel it in my shoulder.
Does it feel similar to your symptoms?
Yeah.
Okay. So that's how we know we're getting some of the right muscles. I also don't think with that one, because you were handling this so well, I don't think with that one I did a good job with the mechanoreceptors. So our body has different types of receptors, and some of them, like pain receptors, are called nociceptors, and they actually travel to the brain slow. Mechanoreceptors, they do pressure. So on these first few, I can still see the ring where I kind of push down. That gets the mechanoreceptors firing, and that will send a message to the brain that it gets there quicker, so it kind of shuts the gate on the pain signal. This one I can't see a ring, so I just went for it, so I apologize for that.
You're good. Oh, like,
Tender there.
feel it like right in my shoulders.
At that point,
Yeah,
that's my thumb.
so crazy.
Yeah, so that's a really tender spot. So the good news and the bad news is it's a spot we need to go for. I guess the good news is it's a spot we need to go for. The bad news is we got to go for it.
Yeah.
So to kind of move the needle around instead of trying to move the needle, what we do is we actually move the skin. So that's kind of why you feel my fingers,
Whoa.
sorry, down below it. I'm moving your skin to hit different portions because we don't want to contort the needle once it's in.
That makes sense. Makes a lot of sense.
Yeah, we want to keep the needle straight up and down. They don't break. These are very, very, very high quality needles, but I mean, you don't want to play a fire either. So.
Right.
Hanging in there.
Mm-hmm.
Now, this may not happen to you, but this does at times involve the autonomic nervous system.
Mm-hmm.
So if you feel yourself getting a little bit, other nervous systems, I should say. So if you feel yourself getting a little bit sweaty, that's normal. If you don't, your body's handling it fine. Sweaty, your body's handling fine too. It's just, it does happen. Sorry.
There we go.
Contrary to popular belief, as a physical therapist, I don't like to cause pain. It's just part of my job, sometimes.
Same.
That's
I feel you. I feel you on that.
That's a fair point. It's for the greater good.
Yeah, absolutely.
I know it's tender there. That's a lot of tight tissue there. You okay?
Yeah. Good.
All right, I'm gonna do a couple in your upper trap,
Okay.
and then I'll probably do like one in what they call the posterior eye of your shoulder,
Okay.
and then that's kind of where we'll hold it for today, just so we don't run over the time.
Okay.
Let's do that. 3 more. You might feel my hand like kind of resting on the back of your head. I apologize. It's kind of funky to get to the upper trap in this position
You're totally cool.
because I have to angle it up. Depending on body styles, the top of the lung comes right around where our collarbone is.
Really?
Yeah. So if we go into the upper trap and we angle the needle down, we could potentially catch the top of the lung. So it's got to be kind of a upward angle, and that's why the awkwardness. You okay?
Yeah.
Tender there?
Yep.
Did it radiate at all, or?
I mean, it felt like my fingers are tingling now, but that's about it.
Okay. Let me know like how that, when we go into these areas, sometimes we'll get those initial symptoms, but they'll start to dissipate. If that's not something that dissipates, like let me know.
it's kind of going away. Oh.
What'd you feel there?
It was just like, I don't know, it just wasn't in the area I thought it was, and it just,
Okay. Muscular?
yeah.
Okay. Okay. So now what we're gonna do is we're gonna do a technique. We wanna get more tissue involved. So again, we don't change the direction of the needle here. The needles are in the direction that I want them to be in based on where they are, but they are straight up and down no matter what. So to get a little bit more tissue involved, what we do is we wind the needle. And how I explain that to patients is basically what it does is if it's like you put a fork in the middle of your spaghetti and you turn it, you actually can pick up the noodles. If you just put your fork in the spaghetti and pull it out, you might get one, maybe. But this allows more mechanical involvement. So it's just 2, literature shows 2, don't need to do more than that. Some of these you may feel something, some of them you may not. Okay?
Mm-hmm.
Good. And now I set a timer. Timer's back here. Okay, so best evidence shows leave them in 10 to 30 minutes. I know you and I talked about this yesterday, Cap, but there's some literature that shows you can have some effect below 10 minutes, and that's using some different techniques with the needle and all of that type of stuff, kind of like some of the stuff we did today with that periosteal pecking. There's no evidence currently that supports any greater therapeutic effect above 30 minutes. So it's not that you're gonna hurt somebody if you leave them in longer than 30 minutes, it's just you're not giving them any extra benefit beyond 30 minutes. So in the clinic, we usually do 10 because there's usually some other stuff that we wanna do. If someone is getting positive results from dry needling and they're like, I don't want you to do anything else than that, then I might leave them in a little bit longer. For today, we are gonna do 10. We wound them at the beginning and we're gonna wind them again. And so while we're sitting here for the time is where we're gonna take some time to do a little bit of education on the needling. And what I did was I just kind of took some common points that people ask me about, and that's what I wanted to talk about. So since I just did the winding and I kind of talked about that, I'll continue to talk about that a little bit. That came from a study that Hong did, and what they were looking at is if you can create more micro trauma, you get more positive effect. So this affects multiple systems. It doesn't just affect the musculoskeletal system. It affects the nervous system, and they've even found impact into the endocrine system. So we get a change in our beta endorphins, which that's a fancy word for opioids. Our body actually produces opioids, the same medication that has a bad rap in the streets because it's way overdone and it's a souped up dose of it, but we actually produce those. So we have the ability to produce those to reduce a painful event within our body. So it gets that system firing and going as well. It also can help reduce the presence of cortisol, which cortisol is a stress hormone, and everyone would know that one as fight or flight. It's good, we need it. If we're hiking and we run into a bear or a mountain lion, we need that extra juice. But if it stays present for too long, everyone has probably heard the studies or known that if that stress can cause weight gain. So there's definitely negative side effects of having cortisol around for too long. So it can help with those couple things. It's also been proven to increase blood flow in the area of the needle by double. So more blood flow to the area, more good stuff to the area. They did a study on knee OA, and people just felt better when you got more blood to that area. So that's really good as well. I think the biggest question that I get, and so that was just a little quick nutshell version of how it works. some other stuff we'll touch on it too, but I think the biggest question that I get, you still okay, Kat? Feeling all right, Kat?
No,
Okay, good.
I'm super
Good.
relaxed.
No, it's okay. So, I just got a little bit nervous. I've not killed anybody, and so I just like to keep checking in.
You know, I've been up since like 3:30, so.
Sure. No, go ahead, take it up. I'll wind up again in a minute, but the biggest question I get is acupuncture. Is this acupuncture? And the answer to that is no. Our goals are different. True traditional Eastern medicine acupuncture is based off of moving chi, which is energy flow, along meridians, which are pathways in the body. These have been found by Eastern medicine practitioners, and they base acupuncture off of a diagnosis given from the Eastern medicine practitioner. Chi and meridians are not things that I understand, but something wouldn't exist for thousands of years if it wasn't effective. So I make sure to let people know that acupuncture is still an effective treatment method if it's done by the right person and somebody who is appropriately trained. I'm gonna wind these again. Sorry.
You're okay.
Some of them you will feel, some you won't. Good. And then dry needling. So why dry needling? The typical needle therapies that we are familiar with are, wet needling, as they can be referred. Takes like a hollow bore needle, so a thicker gauge needle, pretty good sized needle, as anybody who's had an injection may know. And it injects some type of medication, some type of injectate, whatever they're doing. And then dry needling is just using a smaller needle, these monofilament needles, and it's putting it into an area for, it depends who you look at. The group that I studied through, which was the Spinal Manipulation Institute, and Dr. James Dunning and his team, they talk about how it affects the neuromusculoskeletal system, the whole system. Unfortunately, the APTA right now is, which is the American Association that governs physical therapy. They talk about how it's just musculoskeletal. So they call it a couple different names, like trigger point dry needling or intramuscular manual therapy. And those terms are kind of a bummer because this isn't just to treat that system at all. We already talked about how it can affect, our endogenous opioids and our cortisol levels. So if it's affecting that, it can have effect, elsewhere too. Blood flow, all those types of things. So it's for the neuromusculoskeletal system, and it's to address the area of problem. So Kat came in and she unfortunately has right shoulder discomfort. So that's where we went. We didn't do an assessment of her chi and what may be causing that. We just went anatomically at the structures that we did a brief little evaluation to get an idea, and then we went for those structures. But what we've been finding lately, when you're looking at the literature and in this field, you really need to be in the literature and in the evidence. The first study done on the first peer-reviewed study, so quality study, was done in 1979, and it was done by a physician. And he looked at 14 structures, and only 2 of them had anything to do with muscles. So the other ones were tendons, joints, ligaments, neurobundles, perineural needling going along there. There were a lot of different things, and only 2 were muscles. So if we confine ourselves to that, we're doing a disservice based on what the literature says. The literature also, there's been a closing of the gap between acupuncture and dry needling, because certain acupuncturists are starting to get away from talking about chi, which isn't a bad thing. Again, that was developed from years of well, just being successful, from tradition and years of working and being successful. But when they stop using that, we can start using that literature to support dry needling, because they're using a dry needle, a monofilament needle. And what they found was acupoints coincide with trigger points. Trigger points are highly disputed, but common trigger points and acupoints, there's like of the 255 acupoints, 238 of them overlap with what are identified as common trigger points in the body. So it's safe to say that the acupoints and the trigger points, they kind of go together. So we don't need to have this gap that we used to have. If it's quality literature, it's quality literature, and we should use it. But if you're getting acupuncture from from a traditional Eastern Chinese medicine doctor, you know, they probably are the evaluation is gonna look a lot different than my evaluations in here. And you can't really necessarily say that one is better than the other if everybody's getting better, because at the end of the day, that's the goal. You know, even Kat, what you do, like you want the people walking out of your gym feeling better.
Yeah,
so we
absolutely.
all just want people to feel better. If you ever walk into a practice and that's not what somebody wants, leave.
Yeah.
Or a gym even, you know, like,
Yeah.
you know, leave. So that's just kind of a rundown of some of the more common stuff. I probably did miss some stuff, but that is a rundown of some of the more common questions that I get, and kind of a quick and dirty. Obviously, if there's more questions, that's what I'm here for. So honestly, feel free to reach out to me about it. It's something that I think is super cool. So I've tried to do my part, but also the group that I got certified through, they encourage the education part, the research part. So now we're gonna take the needles out. Some of them aren't ready, and you'll see, because some of them will come out with an easy pull, some of them wanna hang a little bit, none of them ever get stuck. Sorry, we found some good areas. That one was easy. Now there's typically no blood with this. It's just not enough to cause the trauma needed for that. But sometimes you will get a little bit. And that's okay, because it just takes a little bit of pressure and it's done. Sorry. Post-workout soreness, and obviously you know what that feels like. Post-workout soreness is very common following this, because if we think about what we do when we work out and how it affects the muscle, we are literally going into a muscle with a needle and then winding it, or doing some pecking, you know, things like that. And we're changing the makeup of the muscle. So the body's gonna respond to that in a similar way as it would a workout. So if you feel sore after this, just know that that is normal. Like, as you can see, some of these are a little bit tougher coming out, but it just shows that they're not ready to quite come out yet. The tissue still has a hold of them. And then all you do is you just be patient, and then they come out. Now, I always like to double check. I count the needles that I put in, and I count them as I'm taking them out, but I also never want to leave one in somebody. So, unfortunately, there are stories that exist about them.
So, oh my God.
Yeah, like people getting home and they still have a needle in them. I'm gonna slip this out from under you. And then you're gonna have quite the adjustment period, because you've been down there for a while.
Yeah.
So take your time. When you're ready.
Oh, I can take a nap.
Yeah. The lights are bright.
Oh.
And then just whatever's best for you as far as coming out of the position. things that we checked initially. So I just want to check them again.
Yeah.
We're looking for worse, better, the same. And obviously you know what soreness is, so just kind of keep that in mind. So the first one that we had was the opposite.
Yeah, that's good.
Okay. And then we had the right arm to left shoulder.
Yeah, just a little sore, but it's better.
Different, okay?
Yeah.
And then we had the one that I did. So if it's okay with you, I'm gonna do that one. You can rest your arm there. I'm just gonna take it from your side. So this one was here. You okay here?
Just, yeah, it's better. Okay. It's like a little sore though.
A little bit more movement, but
yeah.
It's still
sore.
Still a little tight. So, you know, we were able to make some changes.
Yeah, for sure.
Through those areas. So that's pretty cool.
It does feel better though.
That's good.
It does.
And you might get sore. But
yeah, I can already feel sore.
Okay, I was gonna say,
Literally
you as an athlete and then someone who works out quite a bit, you know soreness.
Yeah.
And you know it's okay.
Yeah, I feel like especially like right in here.
Yeah.
Like a lot more soreness.
And we did a lot too with the needles, but the aggression is shown in the literature to give us a better effect. It's not always fun for the person laying down. It's not fun for me either.
Right.
But I don't want to bring somebody in to not give them the best, you know. So
right.
We got to do what we got to do.
Effectiveness isn't always like, you know, rainbows and sunshine.
Right.
That's just how it is.
You're absolutely right.
That's just how it is.
Do you have any questions at all?
I don't think so. I'm fine to like still do.
That's a great question.
Your normal stuff after.
There are no contraindications following dry needling, meaning you can do your normal routine. Just know that there might be soreness. We already talked about that. The only thing that I tell people to shy away from is icing. If my goal with dry needling is to get more blood to that area,
icing's not going to help.
It's going to take it away.
Yeah.
So it's not going to hurt you to ice. You're just going to potentially undo what we just did.
Right.
So if anything, heat.
Okay.
More blood flow.
Okay.
But if you're about to work out again, you're going to get the blood flow anyway.
Right.
So, you know, that's
for
better.
Sure.
You know, movement's always better, but a hot pack can encourage that.
Yeah.
Also, people just kind of like it. So,
absolutely.
you know, it is what it is.
I feel good though. I do.
Good.
I do. And like, is this something that how often do you recommend doing something like this?
Yeah, it's a good question. So the effects can last 48 to 72 hours.
Okay.
I personally do not needle within that window because the body's still figuring it out. It's still healing. It's still doing what it needs to do. So I don't think we need to get in and blast it again. Let it finish. And then let's see how you feel when you're done healing. Because that area that we cleared today, or that we worked on today, after you're done with the soreness, it may be somewhere else. So then we're not going to do the same thing that we just did. We can put some needles in those areas, but we would transfer it. So what I do is definitely not within the 48 to 72 hour window. But if someone comes in even after that and they're like, I'm still a little bit sore there, we'll stay away, we'll do something else.
Okay.
But if someone comes in and they're feeling good, no soreness, we'll go for it.
Okay.
And that's a personal thing. You'll see people, you'll deal with people that'll needle back-to-back days. I just don't know that the literature supports that, and that's why I don't do it.
It's just like, I mean, taking like a healthy break, like after working out when your body's broken down, like you need, that's why recovery days are so important.
Definitely.
Your body can't rebuild unless you take a little time off.
It's a good point. If you don't mind, I'm probably going to use that when I'm talking to people.
Yeah, for sure, for sure, yeah.